The study, fluciclovine PET in metastatic castration-resistant prostate cancer treated with abiraterone acetate, is actually a trial in progress. We have currently open at Tulane University in New Orleans. Conventional imaging is well known to have significant limitations for staging, restaging, and response assessment. And we have been, seeing an emergence of novel functional imaging with PET scanning using different tracers to really improve sensitivity of detection of disease. And a number of studies have now shown superiority of PET scanning using prostate-specific tracers compared with conventional cat and bone scans. 18F-fluciclovine is a synthetic amino acid transport across cell membranes and is upregulated in prostate cancer cells compared with surrounding tissue, and is actually currently approved for patients with biochemical recurrence. However, the role of fluciclovine PET to monitor response to novel hormonal therapies such as abiraterone is unclear and unknown. And so our hypothesis was that actually using fluciclovine PET would allow us a more sensitive assessment of patients with metastatic castration-resistant disease while on abiraterone. And those changes observed in the fluciclovine PET would correlate better with serologic changes in PSA and would allow superior disease monitoring than conventional scans. So we basically opened this single-arm pilot study describing the changes in fluciclovine PEN and compare those results with not only PSA but also conventional cat and bone scans in patients with metastatic castration-resistant prostate cancer treated with abiraterone plus prednisone. So the co-primary objectives of the study included fluciclovine PET changes at baseline and 12 weeks later after being on abiraterone for CRPC, and compare between fluciclovine PEN and conventional scans for potential differences there. Secondary and exploratory endpoints included PSA response, PSA progression, and genomic alterations by next-generation sequencing. So at the time of the meeting, ASCO-G, where this study was presented, we had 2 patients on the study. And to be eligible for the study, patients would have had a detectable PSA of at least 2. Evidence of metastatic castration-resistant disease with detected metastasis on conventional cat and bone scans. So this study was initially planned for a total of 12 patients to be treated with abiraterone plus prednisone or dexamethasone for mCRPC and get fluciclovine PET and conventional scans at baseline and then 12 weeks later. And then we would, continue to follow these patients until progressing or discontinuation of life-prolonging therapy or up to 2 years. So that was the initial design. However, due to the significant change in the landscape or the management of patients with advanced prostate cancer, a lot of patients are now receiving abiraterone in the hormone-sensitive setting. And we amended this protocol to allow other life-prolonging therapies in first-line castration-resistant disease. So as of today, this study is actually allowing not only abiraterone for CRPC, but also other life-prolonging therapies such as enzalutamide or docetaxel-based chemotherapy. We aim to enroll quite quickly with this amendment because we are adapted to the new management or an updated management for patients with advanced disease. And we look forward to present the results from this pilot study in the near future. And what we predict, it's likely that not only fluciclovine, the other PET tracers for PET scan are likely to show to be helpful in not only in the localized recurrent, but also in the metastatic setting. And so we're looking forward to see the results from this trial, and we're looking forward to present them in the near future at future conferences.